We do have two different types of canisters, one with an external filter and one that has an internal filter. For the external filter, you will be utilizing the canisters with the cream colored lids. Your external filter, it is not compatible with your blue lid. Since your blue lid already has an internal filter in place, this will not be needed. Your external filter will be needed for your cream colored lids. Whenever you do get these, they do come in 3 separate pieces. You have your clear silicone tubing, your rectangle filter, and then your elbow connector. Your elbow connector does specify which side goes connected to your bottle. As for your filter, it will let you know which side it's in, which side is out. Typically, we keep the one with the ridges to the outside to connect to the unit, and then we connect our silicone tubing to that as well. If you have a difficult time trying to connect it in this manner, you can always pull out your filter and connect it separately before attaching it to your elbow connector on the suction canister, like so. Whenever you do receive these suction canisters, they will come with the caps detached. You want to make sure that this port right here is covered, like so. You will have this port that will remain open and will connect your suction tubing to it. The other end of your suction tubing will be attached to the patient's Yonker, little sucker, suction catheter. As for your blue lid does go with this specific canister. Always make sure that you do place the lid on and it's nice and tight. You will have a smaller tubing that will connect to the top of the unit here. Like our other cream colored canisters, your ports will be open and you want to ensure that you do close these ports. Your blue lid does have an extra port here that will need to be covered up as well. If it is not covered up, you will have a leak and you will not have a suction pressure coming from the machine. On the lid itself, it will state that this port is to the patient. This is where your suction tubing does go connected, like so, in which the other end goes to Yonker, little sucker, or a suction catheter. When placing your canister on your suction machine, simply place it in the canister holder. Your tubing that connects to your filter goes connected to the port directly on the machine. And to ensure that we do have a good seal on your blue canister only, you will need to cover the end of the patient suction tubing. Turn on your machine. Those 2 pops indicate that you have a good seal and your suction pressures will be optimal. Once you hear the 2 pops and have a good seal, make sure to connect your Yonker or suction catheter back to the patient end of your suction tubing. For the canister with the cream lid, make sure to place it in the canister holder of your portable suction unit. Attach the silicone tubing to the port on your suction machine. At this point, you do not need to cover the end of the suction tubing to perform the click test for your canister. It should be ready to go as is. If you are experiencing pressure issues with the canister utilizing the cream colored lid, first step, you can go ahead and occlude the port on the suction unit itself. If once you turn on the unit and you do see your needle pop up and you do feel a strong suction pressure, your suction pressures are optimal and you can move on to the next step. Your next step will be to connect back your silicone tubing onto your suction port. Disconnect the rectangle filter from the elbow connector. Occlude it with your finger. Turn on your unit again. If you do notice your gauge pressure pop up and you feel strong pressure coming from the machine, you can go ahead and connect back, turn off your machine, and move on to the next step. The next step would be to make sure your lid is tightly sealed and making sure your port is covered in the back. We want to make sure there aren't any leaks within the system that could be causing these pressure decreases. As for your blue lid, first we can remove your tubing from the unit that connects to your canister. We would like you to go ahead and cover the port that is on the suction machine itself. Turn on your unit. If you notice, the gauge on your suction machine popped to where it needs to be to the top, then you do have good optimal suction pressures. If you do have optimal pressures from your machine, go ahead and change out your tubing and canisters to make sure that it is not an issue with possibly the filter being wet or some kind of occlusion happening in your tubing. If you are experiencing the same issues after placing a new setup, please give us a call and one of our team members will be happy to assist.